Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Bella Salon and Day Spa, located at 41 West Main Street in Northeast Pennsylvania, proudly supports Chautauqua Sunrise and its volunteers. More information at bellasalonanddayspa.net. Funding is provided by a grant from New York State Senator Catherine M. Young, representing Western New York's 57th District with a local office in Olean. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. From the Access Channel 5 studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Channel 5. Continuing the traditions of Senior Report, we are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week, countywide, from 9 to 10 a.m. Join us by calling in line, emailing us, or checking out our social media. And now, from the Channel 5 studios, it's Chautauqua Sunrise.
Hey, good morning. We're back for another really good show with you folks, and I want to welcome you back to Chautauqua Sunrise. And if this is your first time, come on in, have a seat, and I think you're going to learn a lot about a really cool topic here in a little bit. Okay, let's get it over with. Merry Christmas. There, I said it again, and you know what? None of the social media police have been to the studio and told me I can't say it. I was talking about this last week. I got a little cheering from the audience here. I still don't know what the big hairy deal is about people worrying about being socially appropriate about Christmas or Hanukkah. Happy Hanukkah for my friends that are Jewish. And happy holidays for anybody that's celebrating anything else that I don't know about, okay? Let's just get out there and just be ourselves and relax and say whatever we want to say to our friends, because everybody's pretty open to this. I don't think there's too many people, at least in Chautauqua County, that can get their knickers in a knot about all this. So anyways, holidays are upon us, and I like it. Hey, how you like the weather? Today, if we all work really, really hard, we can get a lot of hot air going, Randy. I need you, yep. And with all the hot air, we can break the record outside. It's supposed to get 62 degrees here today. Crazy. Okay, I don't know about you guys out there, but I planted some bulbs earlier this fall, and the daffodils are up about an inch. I talked to my dad about this. He says, don't worry, it's okay. They'll just take their time. And they were saying, I think down in Washington, D.C., they're having a second flowering of the cherry blossoms. I guess this is something that happens every once in a while when the weather does this sort of thing. So anyways, enjoy the great weather, huh? I know that people like to have a white Christmas and all that sort of thing, but, you know, kind of made up for 15 Christmases last year. I'm still thawing out from that. Ay, ay, ay. Okay, let's see. I got a bunch of things here to share with you, as always, before we get to our program. First of all, I want to say hi to Jenny S. She posted a great thing on our Facebook site. Jenny, I hope that you're watching this week. I know you have some really nice things to say about Kev Rowe, who was on the show a while back. And you also had a nice compliment about the show, so thank you. And then I want to say hi to Buddy and Busty. Buddy has been a fan of the show and reading my column forever in the Post-Journal, my column from out of the West. And so Buddy, nice to meet you. I had to go all the way to Northeast Pennsylvania to meet Buddy, and he's from Bustye. I'm from Ripley, and we happened to meet at the Bella Salon. That's one of our supporters. And so anyways, it was a pleasure. I said it last week, I say it all the time. I don't think a week goes by that I don't meet somebody or run into somebody that watches the show and tells me how much they're enjoying it. And that means a lot to us here at the studio, that we're doing something we think is important, and that we're bringing information and shows to you of interest, and especially of a local flavor. All right, a few things I want to share with you and some announcements. So let's start with this. My buddy Bob McIntosh over in Ripley is still looking for donations, and I'll be mentioning this from time to time. Donations for the Medal of Honor project. If you know of anyone that served in the armed forces that was born in Ripley or lived in Ripley at any point in time and received one of the top 9 Medals of Honor or Valor, Congressional Medal, Purple Heart, Silver Star, Bronze Star, please contact Bob McIntosh. He's in the phone book or at the town hall. You can get that information. But we're putting together down there some signage, New York State historical markers of anybody that's got any of these awards, and they're looking for donations for that as well. And the names of these ladies and gentlemen that have these awards are going to be publicly displayed forever and ever. So that's a really good project, and I know Bob's looking for information on people that have these awards and also taking donations. If you're interested in donating, you can write a check to the town, and our town clerk, Becky Carvello, is collecting that down there. All right. Crossroads Markets, they are open today and next Saturday, and Mr. and Mrs. Santa Claus are there. And as you know, we always promote buy and shop locally. What a better place to go. All your small towns have shops. Check out Crossroads as well. And many of the people that are from or at Crossroads are from our various local communities that are set up there. So check it out. And that's the next 2 weeks they got things going on, and I'll talk one more time about that next week. All right, and let's see, what else do I have here? Oh yes, this is kind of fun. Lakeshore Center for the Arts, Rick Miscaro and company, they're putting together a new production, and it's called something everybody knows. It's called It's a Wonderful Life. It's the movie everybody watches at Christmas or doesn't watch it because they've seen it 67 times. But anyways, he's putting together a radio version, and I'm almost thinking this might have been before the movie was actually made with Jimmy Stewart and company. But it's a radio production, so people are on stage like an old-time 1940s radio show. And guess who he cast for the radio announcer? Yours truly. Yes, thank you. Ladies and gentlemen, I'm Freddie Fillmore from WBRF or wherever the radio station is. So I'll be Freddie Fillmore, the announcer, and we're really looking forward to that. Also, since we're talking about radio, thanks for popping that up. For our friends over in Jamestown area, you'll be listening to us on Tuesdays at 1 o'clock and WRFALP, Radio for the Arts, low power to the people, as Dennis says. So anyways, thanks for having us as always, and we want to welcome you to the show. So anyways, that production will be happening actually after the holidays, so it won't be ready for Christmas, but Rick is getting the cast together, and we already did a read-through. And when you're in an acting troupe and you have one of these productions, you usually have about 6 characters because there's only so many of us there. And I don't know, there's got to be like 20 characters for 8 people. So 1 minute you're talking in one voice and then you're changing your voice to another. And some people are little kids for a minute and then they're adults, and it's just a riot. So I'll let you know more about that, but that's going to be a lot of fun. Okay, let's get to the other announcements that I have that I get from all of you every week. And as I always remind you, if you have an event, anything that's happening with your club or organization, anniversary, a birthday that you want to give a shout out to someone, let us know. And there's the information you get to us. Some people have taken advantage of it and they've done a really good job. And I'll tell you, the town of Ripley, they took me seriously on this. And so let me tell you what's going on today. Okay, Christmas in Ripley, December 12th. That's today from 10 a.m. to 4 p.m. over in this Ripley School Gymnasium. You got crafters and vendors from all over the county. You know, I'm going to have to stop over there. I got to see what's going on. You got live music from the elementary band and chorus, and these folks are going to be on the show next week. Sue Tilston and Jim Cunningham, they're going to be doing a presentation of some holiday Celtic music. Very cool, huh? Some buddies of mine. But they're going to be performing at the school today. I don't know what time, but somewhere between 10 and 4. Also, besides shopping, there's a Chinese auction, food, and fun. Then, from 4 p.m. to 6:30, there's chicken and biscuit dinner at the Ripley United Methodist Church. And tickets are $7 and pre-sale, $8 at the door, $25 for the whole family. Tickets at the Community Bank, Library, and Town Hall. And then, this is going on right now, from 7:30, so we're already past that, for about another hour and a half maybe, till 11 o'clock this morning, breakfast buffet at the Ripley United Methodist Church, or Rudolph pancake breakfast at Meters from 9 a.m. to 11:30. Then they have something called the Passport to Ripley, which is like a ticket, and if you go to the various spots throughout the day, 9 out of 12 events, you get your thing stamped or whatever they do to it, and you put your passport into the holiday basket drawing that they're going to give away later in the day. 10 a.m. to 1 p.m. It was the night before Christmas, and that's going on at the Ripley Free Library. 10:30 a.m. to 1 p.m. is a live nativity scene at the Ripley United Methodist Church. There's more yet. Horse-drawn hayride starting at 1 p.m. Donation of a non-perishable food item. Wings and Things has something special going on from noon to 4 at their restaurant. Great food there. Tree lighting and angel tree lighting at 6:30 p.m. at Meters Restaurant, and then a candlelight service following tree lighting. And then everybody's into Star Wars. R2-D2 is going to make his presence. So we got him. There he is. He will be there somewhere. I'm not exactly where, but look for him. R2-D2, Sean Moore has put together a replica, and does all kinds of crazy things. So there you have that. So Ripley's got a great day going. I know a lot of you other places do, and they're the only ones that sent me anything. So Mayville, Westfield, send me your information. Be happy to share it. Okay, Infinity now. Smack Dab, a rock group from Jamestown area, will be performing at the Infinity Arts Cafe on Friday, January 8th, starting at 7 p.m. Only 200 tickets are being made available for this performance. For more information to purchase tickets to this event, go to Infinity Performing Arts. That's all one word. Let me say that again. infinityperformingarts.org/shop. Audience members also can purchase tickets in person at the Infinity Center, located at 301 East 2nd Street in Jamestown. Tickets are $5 each, and all proceeds will support music and arts instruction and mentorship for Chautauqua County youth. For more information about Infinity, of course, you can always call 664-0991 or stop at the Infinity Center on 2nd Street. I always talk about these folks. It's absolutely fabulous, great place for kids, and I wish I had an Infinity when I was going up. All right, other information from Infinity also. They will be holding their annual alumni and holiday concert. So all the kids that came up through the years, they come back and they put on a big concert for everybody. That's at the cafe on 2nd Street, Friday, December 18th at 7 p.m. The show will feature current Infinity students and a variety of Infinity alumni. The event is free, family friendly, so there's no swearing or anything crazy like that. Rated G, open to the public. Audience members and supporters of all ages are welcome. Okay, so once again, you can call us. If you didn't send me the information by now, you can call it in and 753-5225. And with that, let me make sure I've covered everything I wanted to cover. Let's take a break. Let's go to a public service announcement, and we'll be back with our special guest today.
Operation KidSafe and Schultz Auto Group, in conjunction with the Schultz Heroes program, have teamed up for the Southern Tier Child Safety Week. Parents get a lifetime KidSafe digital safety record for their child. It's totally private for your family, and thanks to Schultz Auto Group, it's totally free. It's happening Monday, December 14th through Saturday, December 19th at 6 Schultz Auto Group locations in Warren, Bradford, Olean, Dunkirk, and Jamestown. More info at schultzauto.com.
Okay, and that's a great project. If your child has not been ID'd, they have these electronic fingerprint things, and they scan the fingerprints right onto a disc, and then you have a CD of your child and their picture and all that sort of thing. And if you've ever watched the show back when it was a senior report, we had the Masonic group here and the Masonic ID program that they do, very similar to that. So we don't care if you go to work with the Masons or with this project, get your child ID'd, have the information, because you would be surprised, as in our own case when our kids were growing up, we lost one of my kids one day in a not a supermarket, in a department store. He was hiding out in one of those circular clothes racks. We didn't have a picture of him recently, but if you had something like this, you could pop it into a computer. The security guard look at the picture, and then they start searching the building and all that sort of thing. And that's a happy situation. But in case of an emergency, child is kidnapped or walks away or gets lost, you have this information, because so many times our pictures are outdated. And we all have them in our wallet, and they're probably 5 years old. Also, I don't know if I don't recall if they said this, but it's also for senior citizens. Okay, sometimes they're out shopping, they fall down, they don't have their ID or something like this, and if we had that information, you could give it to the police. Or sometimes, unfortunately, we have seniors with Alzheimer's, and they have a tendency to wander off. Great information at your fingertips that you can share immediately. So, good project. Check it out. Okay. Let's get busy on what we're going to talk about today. I want to invite back and thank again Patty Ballman, the director of Westfield Memorial Hospital, and thanks for coming back.
Oh, it's great to be back.
And thank you for the hospital being one of our underwriters. We're so happy to have that nice building every week pop up and doing all the good things you're doing over there. So, Patty, tell us a little bit about what your job is over there. People don't know what a director is.
We do everything.
You do everything.
My job is the day-to-day operations, making sure that we deliver the best care possible to our patients, that everybody's where they need to be, that we have all the equipment, supplies, anything for operations. I'm also involved in strategic planning for the facility, working with the community and our partners in the community to make sure that we're delivering the right services to the patients and meeting the needs of the community. Mm-hmm. And I also serve as a liaison back to our parent organization, St. Vincent Health System.
Parent organization, what does that mean?
The parent organization is our operator, our owner. Westfield Memorial Hospital is an affiliate of St. Vincent Health System.
Mm-hmm. Are there other affiliates besides Westfield with St. Vincent's?
Well, certainly there are other business units, absolutely. Many outpatient centers. We have an outpatient center in Union City. And then over the last couple of years, we've continued to expand that affiliation through the Allegheny Health Network, which is 7 more hospitals in the state of Pennsylvania, located primarily in the Pittsburgh area. Mm-hmm. We're the northern section of Allegheny Health Network, and that is sponsored by our super parent, which is Highmark Health Plan.
Wow. You really got
lots of layers.
You almost have to have this big diagram to figure out where everybody is.
That's exactly what we have.
So it's sort of like those, is it the Russian stacking dolls? We're like the little doll in the middle?
Well, I wouldn't say we're in the middle, but
well, I mean,
absolutely.
Layer. That's what I mean is
all the business units are connected together, and really to serve that mission and vision of delivering the best care possible.
But how cool is that? It's got to be very cool. I mean, it's like. I don't know, folks, if you read the papers, but you see how many times hospitals are struggling out there, and I don't think a small hospital can survive anymore by itself.
It is extremely difficult for small hospitals in rural settings like the Westfield community in Chautauqua County to survive independently. Mm-hmm. I don't think it's the best for the community, because I think we shortchange ourselves by not having access to a lot of the technology and the subspecialty care that you need. We want to make sure that we don't compromise care, that we just expand the resources we have.
I mentioned a little while ago in fun that I'm going to be in this show. There's a tie-in, trust me, there's a tie-in. And It's a Wonderful Life. And in the theme of that show, Clarence the angel that's trying to get his wings takes George Bailey and says, you don't exist anymore. And what would it be like? And George realizes he made such a difference. And so people, I don't think, really appreciate what a rural hospital does, a community hospital does. And if it wasn't there, what would it be like? And I think about it. So let's pretend for a second, if Westfield Memorial Hospital didn't exist in our part of the county, and I needed to, if I got hurt, I got cut, where the heck would I go? I'd have to go all the way to Jamestown. I would have to go all the way to Lakeshore or Buffalo.
Yeah.
I'd have to go all the way to Pennsylvania.
Yes.
So there's nobody to take care of me like right this minute, right?
Yeah, you are correct. And I think that across the country, rural hospitals play such an important role. When we talk about rural, what does that mean? We think about size, and I think about size of the population that we're serving, size of the facility, and also the geography. While we're having a very mild winter so far, keep our fingers crossed, weather plays an important role.
Huge.
The difference between summer and winter, and minutes count when you're hurt, when you're injured, if you're having cardiac events, minutes count. So we want to make sure that we have the right resources in the right place so that we can save lives and get the best outcomes.
Okay, I want to throw something at you. True or false? There's still people that think that Westfield Memorial Hospital is going to close because of the Burger Commission.
No, I couldn't be far from that.
But are there people that think that?
Yeah, there could be
I
people
run into
that think
people every
that.
once in a while
I
and
mean,
say, when are they going to close that hospital? What are you
Yeah.
talking about?
And from a history perspective, I think it was, Doc, you probably know better than I do, probably about 6 years ago, the New York State Department of Health commissioned what they called the Burger Commission.
Right.
It really was to assess the health care across the state of New York and looking at healthcare reform, right sizing, how many beds do we need for the population.
Which makes sense. You should do
Yeah.
an inventory or a review of what's going on in the state.
Exactly. Healthcare is expensive.
But they got it wrong, though.
But they got it wrong. And so Westfield was awarded at that time, 5 years ago, a limited life operating certificate. And to keep it simple for our listeners, that meant that over the 5 years, Westfield was challenged by the New York State Department of Health to redesign and look at what the needs of the community were and to make sure we have the right resources that were economically sensible and our quality was exceptional. And so 5 years has passed, and actually 2015 is going to be a milestone year for Westfield. So New York State is a certificate of need state, which means that the state has to approve all healthcare facilities, whether it's expansion or establishment. So our operating license, which really is our license to do business as a hospital, is up at the end of this year.
Uh-oh.
Yeah, but not to worry.
Not to worry?
Not to worry,
All
not
right.
to worry. So there's quite a process. It's called a certificate of need, and the New York State process looks at the community need.
Okay.
Does this community need these services?
Do they watch It's a Wonderful Life and understand if it's not there?
Absolutely, they
Okay,
do. They
okay.
do. They look at community need. They look at the financial viability of the organization. Is the organization stable? Will it be able to continue to provide that level of care without undue burden on the community or on the tax system or anything else? And then also, and I think probably most importantly, is the quality good?
How do you prove quality? I mean,
There-
people say that all the time. What's good? What's better?
Yeah.
You know, just because you say so,
Yeah.
how do you measure that?
Well, certainly, equality is very, very important, and it is outcomes. It's based on how we treat patients and what the outcomes of those patients are. You know, it's not just how many we do, it's how well we do it.
Okay, so how do you measure that?
We were required at several levels, not at the federal government, at the state level, to report quality indicators. You know, what is the outcome of patients that walk through the emergency room? How quickly are they serviced? What's the outcome of patients who have cardiac events? And so we're required by law to report all of those things.
Oh, so it goes into Albany? And
It goes into the federal government also.
Oh, okay.
Yeah, and it's public knowledge. Yeah, it is public.
And so how are you doing?
We're doing great. We are doing
Says who?
great.
The state?
The state and the federal.
You got
Yes.
that in writing?
You got that in writing.
People that
yeah.
want to come over to the
Yeah.
hospital to show them?
Absolutely,
All right.
absolutely.
That's the proof.
Yes.
You know, you mentioned people coming to the ER and that. I mean, so like you got like 10 people a week that have emergencies, or how many people go through your emergency room?
We see around anywhere from 8 to 10,000 visits in our ED per year.
All right, whoa, 8 to 10,000?
8 to 10,000, yeah, 8 to 10,000.
I'm trying to do the math. What is that a week? That's a lot of people.
Yeah, we, 600 patients, 500 patients a month, yeah.
Holy
Daily,
mackerel.
25, 30 patients walking through the ED.
So are they just from Westfield?
No, we service Chautauqua County.
So anybody from the county can come there?
Yeah, now ambulances from the areas bring, Ripley, Westfield, Brockton,
Okay,
those
the
areas.
Lakeshore
They
area.
are delivering patients via ambulance if need be, and then certainly walk-in patients come from, we actually have patients who, by way of either they've lived here or they visited through the Chautauqua Institute, that come from Buffalo area.
Wow.
So we do have a great following. But back to the CON.
Yeah.
So we've submitted our CON to the state of New York, our Certificate of Need application, and it has to go through various stages of approval.
Is this a lot of paperwork to do
Oh,
this?
yeah, this much. Yeah,
Really?
stacks, yeah.
Holy mackerel.
Looking at those areas, looking at community need, looking at financial viability and quality and service. And I'm very, very excited that we should hear very, very soon that we have a certificate of need that is approved by the state, and we have a perpetual life operating certificate, which means that we, the community of Westfield and Westfield Hospital, have taken those Berger mandates and created a facility that is very, very viable and actually probably better than it was 5 years ago.
Wow. So it's a good thing.
It's a real good thing. It's very exciting.
Thank you,
yeah.
Berger, for kind of
at the time, it's like, oh my gosh,
The sky is falling.
the sky is falling. But when you look at healthcare reform and where healthcare is headed, and we look at technology and just medications and everything, more and more care is being pushed to the outpatient setting.
Wow.
Hospital beds all over the country are contracting. We don't need as many hospital beds.
Why?
Well, because of technology.
Hospitals have hundreds of beds and people.
Yeah, and a lot of them are
sick and nurses
empty.
running around.
Yeah.
What? So where are they? People are still getting sick.
They're still getting sick. So the majority of the care is being pushed to the outpatient setting.
Okay.
So in a rural, technology, I think about my history in healthcare. If you had to have your gallbladder removed, you came in a couple days before, you had all your tests ran, and you got ready for the big surgery.
The big day.
And you were in the hospital for a week.
For a gallbladder?
For a gallbladder.
Now this is.
And you were sick. You were really sick. Now with technology,
Suck it
with
up.
all the non-invasive things, you come in the day of surgery, you have your gallbladder removed, and you go home. And you're.
That's incredible.
It's okay to go home because you feel good.
Well,
So,
they haven't.
yeah,
Catch
so
up and-
that evolution that of healthcare has reduced the needs for inpatient
No,
beds.
look at baby deliveries. I mean, women were in the hospital for what, I don't know, 2 weeks or something crazy
Yeah.
like that. Now they're in and out like a couple days. And
You got it. But there are still those patients that do need
Sure.
a higher level of care. There are people, and so, rural hospitals, and I'll go back to Westfield, through those partnerships with patients, or with, their partnerships with larger tertiary care facilities, we are able to really streamline that transfer process. So if you arrive at Westfield and you need tertiary care, we have ground and air transportation. that
You
can
have air
put-
transportation?
Yeah, we have a helipad
Oh,
right there,
okay.
and we have service that will come and transport patients
Whiskey
to their
away.
facility. So that, and again, time is always important. So we can get patients to the right tertiary care facility.
Okay, you keep
And
saying
care.
tertiary.
Yeah.
I-
Yeah, that's bigger.
We're sitting here, we're like,
What does that mean?
We don't know what you're talking
Yeah,
about.
what does that mean? That means it's a larger facility
Mm-hmm.
that has a larger scope of services. If you're having a cardiac event and you need a heart cath, or you need open heart surgery,
yeah,
or
okay.
any of those things, it is not feasible to have those services in a small rural hospital.
Different purpose.
different purpose.
Stabilize you, do some tests
Yes.
and that sort of thing.
What is important is that we have the ability to get you to the right places for that continued care.
Well, and I'm thinking about this. So let's say you're having a heart issue or something like that, and you say, well, I'm just going to go to wherever, to St. Vincent's, but time's of the essence, so you could
Sure you could.
expire by the time you get to St. Vincent's by car or whatever on your own. So it would make sense probably go to Westfield, get
Stabilized.
triaged. Is that a good
Yeah,
word?
we stabilize. We have, board certified ED docs in our ED.
You do?
Oh, yes, we do.
Where are they
Yeah.
from?
It's through our St. Vincent.
Mm-hmm.
We have a group of physicians that just care for patients at Westfield. They are ED board certified. Our medical director is ED board certified.
ED means
Meaning they've trained in emergency medicine, so they are specially trained to care for people that walk in or are delivered to the emergency room.
Okay.
So that is real important. And what is also equally important when you go back to that community need, if you have to leave the community to get care, specialized care, we want to be able to have services back in the community to help you recover.
All right.
Whether that's physical therapy or you need IV infusions and those types of things, you can come back home to your community and have those done at Westfield.
Perfect.
So it's a nice circle.
I think of people 20 years ago, they were just constantly going to the hospital, constantly doing this, and now it comes into your house, or you just do an outpatient kind of a thing?
Absolutely.
I got a question from one of our viewers, because we have Twitter here and stuff like that, and the question was basically, and I'll expand a little bit about it, but they said, well, if you don't have all these beds anymore, what are you doing with all the space? So how many beds you got, and what are you doing with all the space?
Okay, so from a licensure perspective, we have 4 inpatient beds.
4 beds?
4 beds, and
I got more than that in my house.
Yeah. You probably don't need all those beds, though, do you?
Well,
I'm
the
not
dog
gonna
takes
say.
up 2 of them.
So we have 4 beds. We have hospice, inpatient hospice service.
Right.
We have. So what we've done, so with the space, we had a maternity ward that we.
You don't do that
No,
anymore?
we don't do maternity anymore. We do prenatal care.
Okay,
But we don't
that's
deliver
Dr. Jane,
babies.
right?
Dr. Jane, yes. So we've repurposed the space. We've taken the bedded areas and we've turned those into specialty clinic space.
Okay.
And what we do is we bring specialists to Westfield.
Makes sense.
Yeah, rather than have patients have to leave the community for that care.
Oh, gosh, yes.
So we have a specialty suite that each day of the week, certain specialties are there, and they operate a clinic. We have cardiology.
What do you do there?
That is, cardiologists will, community physicians will consult a cardiologist. Patients got
Oh,
some
all right.
heart.
So you sit down and-
it's like it's their doctor's office. So they
Oh.
go to the Westfield Hospital. It's very much a doctor's office setting. We've remodeled it to make it flow well, and they go in and they see their cardiologist.
So, and if you need to like scan or something, they could do it right then and there?
Right there, yeah.
Oh, very
We
nice.
have nuclear medicine, stress testing, all those cardiac.
Nuclear medicine.
Yeah.
What is
Yeah.
that? I mean, that's where they
They inject,
you?
and look at how you react to exercise and those types of things. in
Okay,
the
so that's when
cardiac.
they put the dye in you and they can see
Yeah.
your veins and all that good stuff. Your heart.
Yes.
Okay.
So we have cardiology, we have GYN and OB clinic with Dr. Jane.
Okay, and you didn't have that for quite a while,
No, that
right?
was last year. In fact, Dr. Jane was here on the show.
Right.
Yeah, and she the clinic is actually very, very popular. We're getting a lot of patients that are coming to the clinic and seeing her, and she's doing a great
I'm
job.
sure after she
Oh.
was here on the show that just blew up the phones.
Oh,
They were just
sure.
calling.
Yeah,
"We want Dr.
absolutely,
Jane."
absolutely.
Is she there all the time?
She's there one day a week.
Okay.
And that is, she's there on Wednesdays.
Okay.
And one day a week, once she's there, she sees patients like an office setting,
Mm-hmm.
and then any patients that need procedures, surgical procedures, she does those also that day.
Wow.
And then those patients go home. When they recover, they come back to Westfield and see her
The
for their
following week
post-op
or whatever.
visit. Absolutely.
Just like they would anything else.
Yeah.
But specialized for women's needs, right?
Yes.
Okay, and that's so
Yeah.
important. And going back, and I don't mean to keep going back to it, but when we didn't have that service, I remember people saying in the community, "Where do I go?
Yeah.
Who do I see?" We
Right.
don't have a gynecologist or anything like that anymore. So awesome.
And it's a one-stop shop. You know, you see Dr. Jane if she wants further studies or just simple preventative things like mammograms, those types of things. Right there, they can go right downstairs into the imaging suite and have those.
You know, during October, we really pushed that here.
Oh, we did,
We were
yeah.
in pink and everything here.
We did, yes.
Why don't you catch your breath for a second? Folks, you're watching Chautauqua Sunrise. My guest today is Patty Ballman, the director of Westfield Memorial Hospital. You can give Patty a call right here at the station if you have a question about services or if you want to suggest anything or anything like that. Give us a call at 753-5225, or you can email us. And if you're way too shy to talk to us, you can talk to whoever picks up the phone. They'll write the question down and they'll get that information to us, all right? So let's keep on going. So rural hospital, and people think a rural hospital is like out in the middle of the cornfield. It's in Westfield.
Main Street, Westfield.
A beautiful town.
Beautiful facility. You know, in addition to the specialists, and Doc, I want to touch a little bit more on the specialists because I think it's
Please do.
important for the listeners to
sit back
know
and
if
you
they
go for it.
don't. Yeah. We have our GYN prenatal
Okay.
care. We have general surgery. We have a clinic on site, and for surgical consults.
Give me a couple examples of general surgery you do there.
We do gallbladders, hernias, any procedure that doesn't require a long inpatient stay, which is
Okay.
pretty much, I mean, with laparoscopic surgery, you can even do bowel resections anymore with outpatient. It's amazing.
Okay.
Lumps and bumps, those types of things, but the majority is hernias, gallbladders. We have a very, very vibrant it's early endoscopy unit.
I'm glad you
And-
said it,
yeah,
not me.
endoscopy.
Every morning, every Saturday morning, I get stuck on one word. I can't.
Yeah, endoscopy, and really that's colonoscopies and upper endoscopies.
So down your mouth
Yep.
and whoop, the other way.
Yes. Real important because we know colon cancer is one of the cancers that can be preventative.
I've read
Yeah.
that. It's very, very treatable if you get on it.
Yeah, and it's not the most popular thing. Folks don't want to just say, I can't wait to go in and get my colonoscopy every 5 years. It's not.
Okay.
And so what we've tried to do is, number one, we've tried to bring the right kind of docs to the hospital to do these procedures. So we have some top-notch medical staff. We have Dr. Russ Elwell, who's an accomplished surgeon that's been in the Westfield community in Chautauqua County for many, many years. He's our lead. We have Dr. Scott Bedwell, who's also a general surgeon, not only does surgery, the surgeries we spoke about, but also participates in our SCOPE program. And then we have gastroenterologists from St. Vincent that come on site to also do scopes. So we have a nice complement of physicians. We've made it real easy. If you just want to go get it done, you just make it as simple as possible. We have a one call.
Wow.
One call to our scope center. It's called a direct scope program. Our nurses will work with you, teach you about the prep, which, by the way, is nowhere near as bad as it needs to be. Years ago, it used to be horrible. Now you drink a little bit, a little.
I didn't get that. I had to drink like 14 gallons
Yeah,
of
well,
salt
next time
water.
you're not going to have to do that. And we get you in and out.
Okay. Okay, hold that thought. We have a
Yeah,
call.
great,
We'll come back to
great.
your specialist in a minute. Good morning,
Yeah.
caller.
Hey, good morning, Doc. Good morning, Patty. I just got a couple questions real quick, and I'll
Okay.
hang up. First one I'll put to you is insurance now. If I was to go to Westfield and then transfer to St. Vincent's, what kind of a nightmare would insurance paperwork be? And the second question
Good
is,
question.
if I don't have insurance, if I came there and was in need of a doctor, would they accept me, throw me out? Do they have a finance plan, or
I don't think they'll throw you
how would
out.
I pay?
Okay, those are
I
great
just,
questions.
without insurance, you just trying to find out
Mm-hmm.
what happens if you get really sick. You just end up dying, or will they accept you? And work out some plan to pay. Thank you.
Okay.
Great questions, great questions.
Wow, thank you.
So let's start with the insurance.
Okay.
Okay, so Westfield Memorial Hospital and all of the physicians that service the hospital are enrolled in all of the major New York insurances, as well as Medicare and everything else.
Univera, Independent Health,
Independent
Blue Cross,
Health,
Blue Shield.
yeah, United, all Fidelis, all those
Empire,
things.
okay.
Yeah, and also in Pennsylvania, if you were to go to Pennsylvania, St. Vincent works very closely with the New York insurances, and so. Those, now, I can't say that we have every single insurance, but if we
the
don't,
big ones.
we will work with you, right?
Okay.
So from the caller's perspective, that should be seamless. You shouldn't have to have a big hassle because we are enrolled with those insurance plans.
And I would think there would be no hassle as far as any paperwork goes. If you're going from
no.
Westfield to St. Vincent's,
No.
you're in the computer, right?
Everything goes.
Everything
We are
with you?
on the same computer system,
Super.
so that information is there. Another great question about what services or what kind of plans can we offer people who don't have insurance or who don't have the means to actually even pay for health care. St. Vincent and Westfield have a very, very generous charity care program.
I bet you most people don't know that.
So if you need, and this is for emergent services, certainly not for things that aren't medically necessary.
Right, life and death kind of
yeah.
things. Okay.
So we have a charity care program, and it is very, very generous. If you don't have insurance or you're underinsured, you have insurance but it doesn't cover a lot, or it's
High
limited,
deductibles or things like that?
we work with you.
Good.
It's a very, very simple one front page application that you just complete, and then our financial counselors will work with you. We will either write off or waive the entire balance depending upon what your individual situation is, or we will put you on a payment plan that meets your needs.
Don't you lose money from that?
Do we lose money from that? I wouldn't say we lose money. It's part of what we do.
It's just
And
part of the
and it's-
overhead?
It's part of our mission. It's also part of being a nonprofit organization. You know, we give back to the community, and charity care is a big piece of that. And so that is a very vibrant program. If anybody has any questions, we have, certainly call the hospital. We have information we can mail to you. When patients arrive in our facility, no matter where, they are also, there's signage to say, if you think you have trouble paying, please talk to us.
Don't be shy about it.
We're very discreet about it. We give them information. We talk to them, and then certainly we need them to complete some of that stuff. And we also work with them to say, gee, you do qualify for certain state or federal programs, and we'll help you get
People are
that.
probably sitting at their homes right now
Yeah.
fretting about some illness that they have or something that's emerging, and
Yeah.
they probably don't even know that they might qualify. So that's
Yeah.
good. Is there a phone number that they can call?
They can call Westfield Memorial Hospital.
Okay, the number?
And that number is, I only know my number, and I'm going to give you my number because I think that's important.
Okay.
It is 716-793-2200, and that's the administrative office. If you call there, they can direct you anywhere you need to go.
Right.
Also on our website, we are required by law to post that charity care program in an easy-to-read format.
All right,
So if you,
that's
yeah.
your Facebook site.
Yeah, so
Okay.
if you go to our website, we can, and we'll get that posted, if it isn't up there, we'll get that posted, and there's information you can click on and read about our charity care program. So back to the caller, I don't, certainly, well, we don't want people, to not go to the hospital if they are sick and
Yeah.
they need care. We'll work with you.
Good. All right. Well, caller, I hope that answers your questions, and thanks for taking the time to do
Yeah.
that. Folks, if anyone else has a question for Patty, that's how you do it. While we were sitting here talking, two other questions popped up, and we're going to get back to your
That's
specialist.
okay.
The question was, do your folks work with fitness? And evidently the question had something to do with the helicopter. Is that expensive?
Certainly, air transportation, when you think about, anything, it is the most expensive.
But critical. I mean, it's
Oh yeah,
critical.
we don't just put people on a helicopter. That is the most emergent patient needs.
Okay.
It is the most expensive.
But insurance pays for that, right?
Most insurance plans, but I can't guarantee you what the coverage is on everything. So we look at what is the best way to get the patient to the next level of care. I can tell you that the majority of our patients are transported ground transportation.
Okay.
But if they need to get air, we have it.
Wow. Now, does the hospital have its own helicopter?
No.
Oh, so you contract with somebody
yes.
that,
Yeah.
come on over here, pick this person up.
Yep.
Okay. Okay, so I hope whoever sends those questions, I hope that answers your question. So,
yeah, and fitness was the other question.
Fitness, yes,
Yeah, we don't-
yes.
So, do we work with fitness? We have a physical therapy department that's
Mike
very
Peterson,
active.
who
Mike
was here
Peterson
not too
was
long
here.
ago. Yep.
And while we don't have a public gym, we have certainly physical therapy if you need that to recover from an injury or a surgery. A lot of joint replacements come there. We also have cardiac rehab. And cardiac rehab is after you have surgery or a cardiac event. It's a phase 2 to 3 phase program. And once you graduate from those various phases, we do offer use of the gym for a very nominal fee for patients that want to come in and have supervised use of the gym equipment.
All right, now let me get this straight. You don't do the cardiac surgery in
No.
Westfield, but after they've had their surgery, they can get the therapy right in town?
Right in town, right. They come to our cardiac rehab.
So let me ask you a different question. So if you've had a knee replacement or a hip replacement and you need therapy, you don't have to go back to wherever the surgery was, you can do it there?
Absolutely, and that is
Wow.
the norm. Patients that go to those larger facilities and have their joints replaced, their follow-up care is done locally.
People may be watching and say, "Oh, I'd like to go to Westfield. It sounds like a pretty good deal," but somehow or another they don't end up because someone says, "Oh, you need to go to this hospital. Or you need to go to that hospital." Is it patient choice?
It's always patient choice. If your physician or you're I don't know, and they don't maybe they're not aware of something, say, well, I would like to go to Westfield. Patient choice goes both ways. When you arrive at Westfield, and you have to have care at another place, it's always patient choice. So we say, you need your options are. So you're in RED. Where would you like us to go? You need further care. Where would you like to go? That's always patient choice.
So if their cousin works at another hospital and they feel good about going there, they go to another hospital
Absolutely.
from there. Right.
We do tell patients, though, that because of our relationship with St. Vincent, that it is really very easy to get the care. We know that the ED
It's
docs will
streamlined.
pick up the phone and call a doctor and say, I'm going to send you a patient. That doctor then knows when that patient arrives, all about them.
Seamless.
They pull up that electronic record because we're on the same system, and they say, okay, Patty's here, here's what we got to do.
Okay. We had our phone call, and we will get back to your specialist. I
Yes.
promise. We still have time. Okay, good morning, caller.
Good morning. I won't talk too long. This is Linda Spalding. Good morning.
I never
Katie.
told you not to talk much.
Good morning, Katie. Good morning, Doc. Katie, I'm so glad Westfield Hospital is still there. It's a magnificent facility. I'm so glad we need it so much in our rural community. And I'm so happy that all of us who gathered and band together to support to keep the hospital in place, that we were successful.
Yes.
And
We are too, yeah.
And you're over in Chautauqua, right? And so
Right.
you guys could use Westfield just as well as anyone else, right?
Oh, yeah, we've used it. Doug and I both have used Westfield.
Wonderful.
And I also hear that you have a really terrific physical therapy center there.
We do.
Right. And Mike Peterson was on the show
Yes.
I don't know, a couple months ago, I think it was.
Yeah, I've heard nothing but good things.
Thank you. They are there. The therapists and the therapy assistants and all the support staff are phenomenal. They're very well trained and they get good results. Patients, when the first visit, they're kind of limping in there. When they leave, they are just, they don't have their canes, they don't have their walkers. It's wonderful.
That's
is
great.
wonderful.
And Doc, you're going to be It's a Wonderful Life.
I'm going to be Freddie Fillmore, the announcer.
Oh, I've been in that production, and so has Doug.
Oh, what was your character? Do you remember?
It was so long ago, I forget. I know Doug had the lead role.
Oh, he was.
He had the real crotchety person. He had the real vicious.
Mr. Potter, I think it is.
That's who it was, Mr. Potter. Mr. Potter. Yeah. So I also wanted to mention that we do have services with the Chautauqua County Office for the Aging, and we have our senior employment training and computer training.
Cool.
And at sites, Westfield and Brockton. We're opening our site again in Dunkirk and soon in Jamestown. And, of course, we have one in Olean. So we have jobs and we have training.
They're everywhere. All right. Awesome. So call that number, talk to Linda, and get it there and get a job.
753-4471.
Gotcha.
And Hanukkah is just about over. Happy Hanukkah to everybody.
That's right. Okay.
Have a great weekend and week.
All right. We'll talk to you next time, okay?
Okay, thanks.
Thanks, Linda. Bye-bye.
Bye-bye.
Okay. Patty, tell me about the specialist.
So no, it's great dialogue here. Back to what services we offer on site in that specialty clinic.
Anything you want to talk about?
Repurposed.
All right.
So we general surgery I had mentioned, orthopedics.
What's that?
Orthopedics, anything with bones.
Okay, bone doctor.
Yeah, so we have weekly orthopedic clinics. Same thing, same concept. The surgeons are there seeing patients, and then if you need surgery, most of the time it can be done there. If they can't do it there, they will do it at their home hospital.
Okay, foot surgery, do you do that there?
Podiatry?
Yeah.
We have podiatrists on staff.
Really?
That do surgery in our operating room.
So you got those bunions or goofy toes?
Oh, yeah. All the things that... in speaking of operating rooms, our operating room is going through a really nice facelift. So the surgeons and the OR nurses are so excited. We've updated a lot of equipment, put all new flooring in. It's bright, it's cheery, it's really very, very nice.
So how do you pay for all that?
Well, certainly we have a capital campaigns through our parent hospital, and also our foundation. The Westfield Memorial Hospital Foundation is so active, and we are so grateful. They, through fundraising, and actually through the community, and the community support through donations and everything is incredible. So we depend on that foundation for a lot of our updates. In 2016, we have a big upgrade or update planned. We've been fundraising. The foundation's been fundraising for now about 3 years, and we will be modernizing and updating our emergency department.
Wonderful. And there's another group that helps you out that was on the show.
Yes, the Auxiliary.
The Pie Ladies.
Oh, the Pie Ladies. And they do small projects every single year. They just finished remodeling our IT, our computer training room. When you're in the hospital, stop by and see it. It's beautiful.
Where is it located?
It's on the second floor, right across from the pharmacy.
Okay.
And I want training now because it's so nice.
Hey,
it's
Linda
beautiful.
Spalding has some training over there.
Yeah, it is nice. It's beautiful. It's a very relaxing environment where the staff can come in and learn and be comfortable.
And that's important, right? Because the technology is constantly changing.
It's constant, and training is constant. We're always having to update ourselves. So good things in 2016 too with our emergency room update.
Okay, a question popped up. It's going to fit in what you just said about IT and a specialist. I'm sure of it.
Yeah.
Telemedicine. Everybody talks about this from time to time. Is it a reality?
Well, telemedicine is one of the technology is there. The technology has been there, and telemedicine for the listeners and viewers, it really is using technology, computers, to have interactions with healthcare providers somewhere else. They're not physically there. And so the technology is there. The healthcare regulations are just catching up with technology. There's a lot of things like, you have doctors from out of state, are they licensed? States are now coming together, so regulatory is getting caught up with technology.
That must be a headache.
We have had telemedicine capabilities at Westfield for 3 or 4 years now. We have big screen. We have all the things. We do telemedicine or conferencing With our bariatric program, we were doing that. But I think over the next 3 years in the state of New York, you're going to see more and more telemedicine opportunities.
Okay.
It's being pushed by the state as an economically viable way of reaching those specialty care that you can't normally get in smaller communities like Westfield.
Okay. Okay, what other services that we touched on?
Well, we did mention briefly that our imaging services, our radiology department, we just finished, and talk about technology, it's very exciting. We just finished installing a 16-slice CAT scan machine, state of the art.
What was it before?
It was 8-slice, 6-slice, I'm not technical.
What are we talking about here, slice?
Well, I can tell you is, and this is in plain language, because I'm not a radiology specialist, that the 16-slice CAT scan machine, first and foremost, the quality of the images, how they slice it to look at.
It's like depth?
It's depth,
okay,
okay,
like
it's remarkable.
Sonar, radar, whatever.
Yeah, it's remarkable. But I think from a patient safety perspective, these new CAT scan machines have low radiation.
Okay.
That is real important for people who have to get CAT scans often.
Mm-hmm.
Maybe they're suffering from a chronic disease and they're getting treatment such as cancer, and we want to monitor that. They're getting frequent CAT scans. They're not getting exposed to a lot of radiation through this new technology. Children, their bodies are small.
Yeah.
Do this CAT scan. It's less radiation.
Okay. Before it would have been all the same, probably.
Yes,
wow.
yeah, high radiation. It's been an issue. With technology emerging and we're using it, it's been an issue. So our new CAT scan machine is not only better quality, but really, really looking at patient safety. So we installed that last month, and we're pretty excited about it. It's
Wow.
real great technology.
Super. When I've had a chance to visit not too long ago at the hospital, and I saw a lot of people coming out with these dark glasses and stuff. What's going on?
Oh, well, dark glasses. Dark glasses is eyes.
Okay.
We have...
the eyes have it.
Yeah, eyes. We have a very, very vibrant eye program at Westfield through
Really?
a partnership with...
There's a lot going on in that hospital, isn't there?
Yeah. Cataract surgery is really become one of our specialty areas. We have a great partnership with Dr. Haverly and Dr. Kruvilla, who are ophthalmology surgeons who come to our facility, and we do a lot of cataract surgeries.
Like how many a week?
We do, I go by months, you go
Oh,
by
how many a
weeks.
month
So, it's not uncommon for us. I will tell you, about over 400 a year we're doing.
400
400 cataract surgeries a year for our service area.
times 2, so that's 800 eyes.
Yeah.
Wow.
Yeah.
That's a lot of eyes.
So we're
That's
doing a
surgery.
lot of eye surgery. We also are in the process right now, because of the eye program is so vibrant. We're actually putting some new technology in the OR for our eye surgeons to be able to get them the latest and greatest. It really is simplifies even more so the procedure for the patient. And I will tell you, being a nurse from
Please do.
Yes, that when you were having cataract surgery 25 years ago, same thing. You were admitted to the hospital the day before.
Oh,
You had
okay.
all these eye drops. You go have your cataract surgery, you come back and you'd be immobilized with sandbags around your head.
Oh,
And you'd
gosh.
have to stay there and not move because you didn't want to. Now, patients come in, the eye surgery itself takes minutes. They recover for a couple hours.
bing, bing.
They have their sunglasses and eye drops on, and they go
ya.
home. It's wonderful. It is
Okay,
wonderful.
Patty, we got 1 minute left.
Oh my gosh.
Yeah. Anything you want to announce, or anything you wanted to share? Or tell them you got it.
Well, I think I'll take this last minute to talk to the audience and wish them, number one, Merry Christmas.
We can say that here.
Merry Christmas. And as the new year comes, don't ignore your health.
Okay.
Health is very important. Preventative is the best medicine. Prevention is the best medicine. If you want to know more about services that Westfield offers, please don't hesitate to call. I will personally talk to you. And also, we can get you services that you need or help you connect with healthcare providers that you may need. So don't ignore your health in the new year. Have that be one of your resolutions.
And if they want to get a hold of you, it's 793-2200, or you can
Yes.
call the number that's on the screen,
Yes.
326-4921. Patty, as always, thanks for coming on. You're going to have to bring one of those doctors on there. I'm a a doctor. They can't be afraid of me.
No,
Bring 'em
yeah, we
on.
need to get the doctors here and really talk about some of those specific issues.
Okay. Folks, you've been watching Chautauqua Sunrise. Patty Ballman, Director of Westfield Memorial Hospital, and my guest. We want to thank everybody for tuning in. Folks are listening on WRFA, and we're going to do it all again next week. We got a holiday special coming up. Yeah, right here in Chautauqua Sunrise. So you have a great weekend. It's not holiday quite yet. And be safe out there and get those Christmas presents wrapped, okay? Take care. Go easy.